Okay, so three, two, one. Yes, we're ready to go. So, hello everyone. Welcome back to another virtual dental shadowing session. Today we are very lucky to have Dr. Alisha with us today. Dr. Alisha, thank you so much for giving us your time. I understand that you have school and everything, but you are able to spend your time with us. So, if you're ready, just go ahead and start introducing yourself.
Okay, thank you, Scott. So I'm Alisha Prince. I'm an international student, which means I graduated in India, and now I'm a DDS candidate here in the University of Colorado School of Dental Medicine. So a little about me to go over my background. I did graduate with a BDS degree, which is the Indian equivalent of a DDS degree. I did a 6 month senior internship, which is separate from the compulsory rotations that we have to do. This was after graduation. I did a senior internship in the government hospital there. And then I worked as an associate dentist for 3 years. And then I moved to the US. And in the US, I first thing I did was I evaluated my resume from India. I decided, okay, these are the spots which I'm missing. So to kind of complete that, or fill in those gaps, I did dental assisting for a year with a dentist in Kansas. Then I went on to do a master's in biological sciences, and that was in Wichita State University. And my master's wasn't in public health, it was in biology. So, what I mean is, we studied everything from like cancer biology to general microbiology and everything. And that also helped me later in my dental education. My research during my master's was with Streptococcus mutans, so which is one of the main bacteria which cause dental caries. So I think that also helped me in my journey. During my master's, I worked as a graduate teaching assistant, which I continued to do after graduation as an adjunct professor. And I also worked in another school at the same time, which was Newman University. And at that time, I taught things like anatomy, physiology, human biology, human organism studies, and things like that. Then I applied to school, and I'm now here at the University of Colorado School of Dental Medicine. It's been my dream school. In fact, I was at a conference in 2016, and then I was in Colorado, and then I told my husband, I'm going to be here someday. This is the school I'm going to go to. So I'm actually very lucky that, like, very grateful that I'm here. In fact, I was accepted in two other schools, but then I rejected those invitations and I joined Colorado. So that's how much I was, interested in this school in particular. So one of the things which usually comes up when I tell people that I'm an internationally trained dentist is, where do you even begin, right? How do you go from your education in your home countries to getting a license and practicing here in the US? And the first thing I would say is objectively evaluate your experiences. We all have a strong points. Remember those too, not just your weaknesses, but even your strong qualities. So in my case, I did have practice management experience when I was an associate. So that helps me. But then my weaknesses would be, I didn't have any like research experience, or my GPA in my dental school wasn't very high. And so being objective about where your weaknesses are, that's going to help you a lot in your next steps of planning towards your DDS. Um, so in that aspect, one of the other weaknesses I did have was, I knew how dentistry was practiced in India, my home country, but I didn't know how it's going to be different from the US dentistry. I had no idea about how insurances worked. I had no idea how you comprehensively treatment plan a patient, because in India, it's more like a patient comes in with the tooth all bombed out, you either extract or root canal or fix it up, right? So how do you go from like getting your perio stabilized? How do you then take care of the dental caries? So the step-by-step protocols was something I wasn't aware of. So dental assisting really helped me in that aspect. to help with my GPA, I did my master's, and that showed the schools that I'm applying to that, hey, I can study, I can manage a full course load. And while having other volunteer activities too at the same time, it also shows them that, you're not just focused on one thing and giving up everything else in your life. You still have something else going on too, which means it shows that you have work-life balance. So that's kind of what the schools are even looking for. And that's how they evaluate your whole so-called profile, right? So the first step is going to be objectively evaluate all your experiences. And then, of course, you take your NBDE, which is your National Dental Boards or your Integrated National Dental Boards. It's what's currently offered. You're going to complete that to be eligible to even apply. They also expect good TOEFL scores. 100 is typically okay, but the better your TOEFL score is, the better your chances of getting in now. And the reason why they kind of look for that is you are going to have to explain to your patients everything from their treatment plan, right? So they kind of want to know that, okay, you can have that basic communication skills with your patients or with your faculty. That's why they're looking for TOEFL scores. And then, of course, you have your CAPIT application, which is what most schools go through, but not all schools. There are a few schools which do not go through CAPIT. So if you are interested in maybe eventually settling in a state which does not go through CAPIT, just reach out to the school and ask them if they offer any other program or any other opportunities which are not actually showing up on your CAPIT website. Like, for instance, I was first in Kansas, so I did look at UMKC, which is the University of Missouri, Kansas, and they are not a part of CAPIT, but they did have a special allowance for internationally trained dentists. So you can always just reach out to the schools directly and see if, sometimes they might let you into the first year of the program, but allow you to accelerate through the program if you're an internationally trained dentist. So you don't have to stick to what's given on the ADA website, is what I'm saying. For your CAPIT application, letters of recommendation, that's going to be immensely important. And every school has its own requirements, what they are looking for in letters. So that's another thing you'd want to ask the schools directly. Some schools, most schools need a letter from your dean or your principal, depending on where you went to school. And then some schools say, you know what, it doesn't have to be the dean. It can come from any of your faculty members, anyone you've worked for, as long as they can talk more about you personally. So reach out to the schools and find out what they want. And then most schools have a supplemental application. So your supplemental application is going to range from tell me about some weaknesses which you haven't mentioned in your CAPIT application. Or it can go something about, what about my school do you like? So knowing exactly what goes into the supplemental application, that's also going to help you. And then you have your bench test and your interviews. Your bench test is going to be how they judge you based off of your hand skills, right? So your hand skills, they usually ask you to do maybe a class 2, a crown prep, and that's going to be on a typodont tooth, on a mannequin. So start practicing. I cannot stress that enough. Start practicing. If you plan to eventually go to the US, start practicing yesterday, right? That's how important the bench test is going to be. Because honestly speaking, everyone there at the interview date has the same or similar qualifications, similar experiences. And so the bench test and the interview is what's going to set you apart. And then, you're joining your DDS program, which is what you've always wanted. But that's also a long ride. You'll be learning so much. It's sometimes like drinking out of a fire hydrant. There's so much coming at you. You have your didactics, you have exams, you have patient work, you have sim lab. So there's always so much going on. So it's very important at that point to stay organized. And during your DDS program, you'd end up taking your licensure exams. Initially, it was the ADEX, you have the REBS, and a few others, depending on where you want to start practicing. So the licensure exams is going to be a big part of your dental education. Gratefully, we are moving towards mannequin-based exams now, which is more ethical. But depending on some schools and some locations, they may even ask for patient exams. So that is something you'd also have to keep in mind. And once you get your license and once you've graduated, you're now a dentist. So what are my tips for international dentists? Remember that what worked for one candidate may not work for everybody. So like my best friend could probably be a public health get a master's in public health. But if I'm not interested in public health, it's definitely going to show up when they're asking me questions about it, right? So just doing a public health for the sake of doing it and not actually being interested in it can actually hurt your entire application process rather than help it. So find what you are interested in and go for that. So for me, I liked microbiology. I've always thought, bacteria everywhere. This is what's causing caries, right? So that's why I went towards a master's in biology route. But if you're not interested in biology or anything, find what you're interested in. There's always something else you can do. Well, someone I know did a master's, she did a law degree and then joined dental school. But the way she was able to explain it in her statement of purpose was that she's interested in forensic odontology. So having a law background is going to help her with, getting into becoming a forensic dentist. So as long as you can explain your whole story and why you're doing what you're doing, that's going to help you immensely. And in fact, you don't even need an extra degree. Your work experience, shadowing, the assisting, all of that is going to help you. And another thing is know the programs individually. One of the pitfalls which come up for a lot of candidates is they'd go in for an interview. And then if you're coming to the University of Colorado, where every international student is known as an ISP student or the ISP program, and then you refer to yourself as an AS student, which is used as a term used in like Boston University and other places, then that's going to hurt your application too, because they are going to, from their perspective, from an interviewer's perspective, they're like, this person doesn't know our program. So they have just applied for the sake of applying. So we obviously take someone who's more interested in us versus someone who's just wanting the degree, right? So know the program, know the acronyms. That's also going to help you. Try what I did was I had like a spreadsheet and I had a folder where I kept every school's, like everything from what they call their program, which month they start, what are the special opportunities offered by those programs. All of that were listed in a spreadsheet, so that way I knew I wasn't confusing one with the other. So having something like that is also going to help you. The other thing is be professional in all your interactions. It's unfortunately, there are a lot of faculty who are still very old school. And when they see emails with like short forms or, hey, how's it going? They are not as welcoming, which is unfortunate. And I'm not saying that's right, but that's kind of how it is. So at least until you get your one foot through the door, try to be as professional as you can, put your best foot forward, avoid abbreviations, and always refer to people with their right salutation. So if you know it's someone from like administrative side, hey, good morning, Miss So-and-so, or Mr. So-and-so, or even just good morning, versus referring to someone by the wrong salutation, like calling someone a doctor when they're not. That could also be offensive to some people. And especially for a few of the East Coast schools, that's the case. So be professional in all your interactions and make sure that you're always putting your best foot forward. The other important thing is find your support system. Is it your friends? Is it a mentor? Is it your family? A support system can be anything. Is it someone you met on NBDE Facebook group or on Instagram? Make sure that you know someone who can be your cheerleader. And that's very important because there will be times when life will get you down. I've received letters of rejection. I, not gotten opportunities which I would have liked to have. So, and through every single step, you need someone to keep pushing you and reminding you that you're doing this to get to this destination. So, 5 years there has your best in mind. And work, study, volunteer, whatever it may be, do what makes you happy and make sure that it's something you want to do in the future. Because not everyone is going to have the same opportunities. Maybe someone can't afford a master's. Maybe you don't have the visa to work as a dental assistant. So just go out and volunteer with the Red Cross, volunteer at the community clinic. So you don't have to actually go out and do something just because someone else is doing it if you don't have the opportunity to do it. And that does not make you a bad candidate. No one's going to come out and ask you, hey, why haven't you done this? You just have to tell them, look, these were my circumstances and you did the best that you could with the circumstances that you had. So do what makes you happy, find what gives you joy. Focus on your why. Why are you even doing this? Why do you want to become a dentist in any country, right? Why do you want to go into your specialty program? Or do you want to be a general dentist? Do you want to not do practicing dentistry and go into the practice management side? Find your why and start working towards that. And as long as you can explain that in your statement of purpose, that would also help you because they know that you're not just doing things for the sake of it. And then most importantly, it's the bench test. Start early, start preparing as soon as possible and get feedback from reliable sources. And I would stress reliable because unfortunately, it's kind of become a business too, about just helping international students. It's also become kind of a business. So some sources may not be as reliable as others, and so be mindful of that. Read reviews, ask, check out different boards like online boards and see what people say about these different groups, because that would also help you. And in fact, and that's same thing goes for even like your statement of purpose. There are so many editing services, so many individuals doing that, but they may not have your best in mind. So try to find reliable sources and reliable people to reach out to. Because if you give maybe say $200 to someone to write your statement of purpose, but then it clearly reads like them and it doesn't read like you, then the people who are reading your application are going to know that that's not you, and they are reading that letter to get to know you. So that's going to be a waste of their time, a waste of your resources, and it's going to hurt you in the long run. So find reliable sources and practice, right? Practice for your bench test, practice for your interviews. If you're making a call to the school, think in your mind what you're going to say, right? Like practice everything, make sure that you're on top of it, because I assure you, everyone else is. People on whoever you're interacting with, they are going to be practicing too. So get started as early as you can. So now that I'm in the program, what does my typical day look like? Initially, this was my first semester at CU. We had a lot of didactics, so a lot of theory, and we had a lot of labs. So labs were where we go in and then work on like typodontics, on models, and maybe on each other. So we even went to like local anesthetic lab where we gave shots to each other, took impressions on each other, and it's a lot of fun. So we had a lot of labs, preclinical simulation labs, and mixed with a lot of didactics. And that was the first year. It was accelerated, it was hard, it was worth it. Because that got us ready for our second year, which looks like this. We are in clinics most of the day. So our first hours are going to be maybe like one didactic class, and then that's followed by clinics. So we are seeing a lot of patients. We are maintaining our own patient pools. We are making sure that our patients go through the entire treatment protocols, as in the phased treatment protocols. So we are the sole person responsible for the patient getting overall care, including all the referrals that they need. So that is pretty much what we do most days. So it's a lot of clinics. And I come back home, and in the evenings, it's either catching up with patient notes, getting my assignments done, or just doing different hobbies that I'm interested in just to avoid burnout, right? So that's kind of what my typical day looks like. And on the weekends, I try not to actually do anything dental work. I try to, unwind, relax, get my house in order, clean. So that's pretty much what my typical week's like. What I'm currently enjoying in dentistry is the whole digital aspect of it, which I did not get much exposure to in my home country, which is India. So this was this program called Mesh Mixer, where they let us take scans of teeth, and then you can put 3D models in there, and then you can do your wax up and everything digitally. It's very cool. So even for our patients, we've been doing digital scans. So that's the iTero. And it's a very humbling experience, because even on your typodont teeth, you can make your crown prep and then scan it and then look at it blown up in this big computer screen, and you can pick out every single detail which could be better, right? So and that's a scanner. So having that makes it amazing. Like the software kind of shows you even where your undercuts are and your crown preps. So that's one of those things that I'm absolutely having fun with. And in fact, the picture on the right is one of my patients. We were able to scan her and figure out what would be the best way to help her close these gaps, as she said. Would it be braces? Would it be composite veneers or porcelain veneers? Which parts need to go? Which parts need to be added? All of that could be done digitally. So it's also nice because there's less lab time. I can actually come home, put on a TV show, and then work on my patient's case. So it's nice that way too. And I absolutely enjoy where dentistry is going towards the future, especially with CAD cams, and where you can plan everything digitally. Like this was an implant planning class. So we could take like a patient scan and then mark out where the bone is, where the IANB is. Everything can be done digitally, and that way we can make sure our patient gets like the best treatment plan as far as like even implant placement is concerned. So one of the questions which came up was, what is the hardest thing about being a dental student? I would definitely say avoiding burnout. And I've seen this time and time again in my classmates, in people who have graduated, in people who are just starting out. So find a hobby. You definitely need to have a life outside of dental school, because doing the same thing day in and day out definitely leads to burnout. And another thing which could help with that is continuous learning. If you're going to be a dentist doing just composite restorations day in and day out, it's not going to be as challenging for you. You're probably going to burn out faster. So go out there, learn, better yourself. And that's also going to be better for your patients too, because you are now armed with these new tools which you can give to your patients. So continuously learn, improve your skills, and also be mindful and meditate if you're into that, right? Because you need some calm, some peace, and some quiet. Everyone needs that. And also remember that you're never ever fully caught up in dental school. There's always something left to do, and that's okay. Things are not going to blow up overnight because you forgot to send a form in today, which can be done tomorrow morning. It's okay. Give yourself some grace. Be organized. Do your best, but give yourself some grace in the whole process. And in fact, like I cook, I play with my pets, I make silly Instagram reels, which people think like, okay, how are you doing this? But this is my way of avoiding burnout. So be yourself, be silly. No one's going to judge you for it. What is the other thing is musculoskeletal pain. Yes, it might sound complicated, and I did put a reference in there about it, but your body is your tool. So having bad ergonomics, having bad posture, leaning over your patient all day, that's going to really send you to an early retirement. So from day one, even as a dental student, see how you're placing your neck. Are you coming back home and then just lying down because your back hurts? Then obviously you're doing something wrong, and try to adjust your ergonomics based on that. I can't tell you the number of times I've seen dentists who have to retire early because of either back problems, arthritis, neck problems. So just try to be kind, and that way your body is going to thank you later. And that's kind of goes into keep fit, right? So the more you work out or just stay fit, the more it's going to help you in the long term with all these back problems and everything that's going to come up. Another thing which is hard for dentists in general, at least in the US, is dealing with insurance. You're going to hear that a lot when you start practicing. So when you deal with insurance, the insurances kind of also dictate what treatments your patient may accept. So there may be some treatment which is probably the best option for your patient, but patient's autonomy comes first. So they are going to choose a treatment which they can afford. And what they can afford is going to be the treatment which is probably covered by insurance. So dealing with insurance is always going to be an issue. There are a lot of dentists who are going away from the insurance model here in the US. But again, it takes years of building up your practice, building up your trust and between the patients and you, all of that to get to a practice model like that. But that's definitely one of the hard things about practicing dentistry, at least here in the US. So that's pretty much all what I had. What questions do you have for me?
Thank you so much, Dr. Alisha. So we have some questions. The first one is, do you recommend explaining about gap year in our SOP?
Definitely, because it's going to come up. And if they are going to notice a gap in your CV, they're going to know why you had a gap year. So use your SOP as a way of explaining those weaknesses or strengths. You could have done something to better yourself as a person. You could have done something because that's just what life expects of you. There are people who have taken gap years because they've had kids and they had to be there for their families or take care of a sick relative. And that people are understanding. Your entire resume doesn't have to be just one size fits all, but use your statement of purpose to talk about these things. So instead of it being a red flag to a person reading your letter, they can read that and say, hey, you know what? This person had to take this year off, or this person went out and enriched themselves. They've made themselves more culturally aware. They worked, they saved up money for their education. They were giving to the community in the way that they were. So try and explain it that way. But yes, definitely explain your gap year.
Okay, the second question is, what was the structure of your personal statement?
So my personal statement, you can't really have a structure. It has to read right. And there are always different ways of doing this. So some of the personal statements I've read can start off with, when I was a dentist, this is what I learned, and this is why I want to do dentistry here. Honestly, my personal statement, I wanted to show them exactly who I was, right? So I'm not this person who's very within the box. So my personal statement started off with, tiny dinosaurs line my windowsill made out of dental wax, because that was how I got interested in dentistry. My dad was a dentist, so I'd go to his lab and work with dental wax and make different shapes. So that's literally what I put on my personal statement. So use a personal statement to show who you are. If you are a more professional person, if you prefer to be that way, show that, because there are schools which are looking for that. Right. And there may be schools which are looking for people who they think are easier to get along with. Or there might be schools who want someone who's just interested in academics. But when you show them who you are in your personal statement, you're also making sure that you are a right fit for the school. So if I was someone who was that way, if I wanted to go to like an East Coast school, which is a lot more within the box, then that would have been a better statement for me to like write, as in, when I was a dentist, I did all of these things, right? But then I wouldn't have felt as accepted in that school structure. That's what I'm trying to say. So show them who you are.
So personal statement doesn't have to be very serious. You can start with like a kind of like a story to
Yeah,
attract the attention.
absolutely.
That's true.
Yes,
That's true.
definitely. You can definitely start with a story. One of the things, though, about stories is try to avoid cliches. Okay.
Hmm.
And what do I mean by that? Even friends who have just given me, I do not do this as a business. I don't expect money from this. But there are friends who would like, send me their resumes and say, look at it. And the number of times I've actually read when I was growing up, that's probably a terrible way to start it, because
Yeah.
100 other applications are starting off like that. So I grew up in a village. I was 5 years old and I fell down and had to get my tooth fixed. So now these, even though if honestly it is your actual story, the people who are reading it are kind of burnt out reading that, right?
Uh-huh.
So use your story. Yes, you probably fell down and broke your tooth when you were 5, but how do you frame it in a way that
Yeah.
captivates their attention, right? Like, and once read the statement where someone was like, I saw the dentist walking towards me with a needle, and I was like, what? But then I wanted to keep reading.
Uh-huh.
And so that's kind of what you want to. You want to capture their attention, make them like, give them a hook, reel them in.
Got
So
it.
yeah.
What was the hardest part about preparing yourself for the difference in expectations as a dentist in India and the US? For
That's a
example,
great question.
solving a problem versus treatment planning.
Yeah. And honestly, I deal with that till date. And there is no easy way to do this, because like I would want to go in there and fix something, but that just going in there and fixing it is probably not the best thing, because if the patient's periodontium is compromised, there's no point in me, going there and filling the tooth when the tooth has to be extracted. So that's something that's definitely hard, and that's something that would come in time, I feel, because it has gotten easier the more patients I've seen. And also the expectations vary. In India, your patients are going to, honestly, one of the other things when it comes to expectations is not just from your faculty but also your patients. So in India, if I was to say I'm going to charge 1,000 rupees for a procedure, and my patient is going to balk at me, like, that's a lot. But then here I'm giving my patient a comprehensive treatment plan which is worth like $2,000, and they're like, you know what, I'll try to make it work. So also my own expectations on how much, what I can expect from other people is also different. So my only thing, like my only advice in that state would be, try to be open, just put it out there and see what people either accept or don't accept. But try to stay within the realms of the practice that you're working on, in the sense that try to learn the new way of doing things. There is a reason why schools here teach you a different way. So be open to learning. There's always something that you can learn from every interaction you've had with like faculty members, patients, even the staff. So try to keep an open mind and go in with a learning attitude, and that would help you.
So the people in the United States, they are more willing to pay, but they also have higher expectations, right?
Yes, definitely. So one of the problems with that is that it's a very litigious society, which means if you're a practicing dentist, your chances of getting sued are also present, right? So patients expect that quality of care. So the way you kind of make sure that you're either giving the quality of care and documenting it is by keeping your treatment records pristine, including this patient walked in, we made sure it's the right patient with their date of birth, so timeout taken, patient identity verified, so that way you're covered covering all your bases. But then the patients also kind of expect that from you. They expect you to be a professional. They expect you to, make sure that you are having their best in mind. And they also want to make sure that you know what you're doing. We get a lot more questions here from our patients than I did in India. Because the way our patients were in India was, you know what, you do your thing, you know the best, just go ahead and do it. But here it's like, but why? But I did Google it and this is what came up. So make sure you know exactly what you're talking about before you start preaching to a choir who already knows everything about everything. So trying to do that is also kind of hard. But it also has the flip side, which is your patients Google a lot of things which may not necessarily be right. So trying to explain to them, like, you're brushing with charcoal toothpaste is probably not the best for your enamel. That's also kind of a discussion you'd end up having. So you'll need to know exactly what you're talking about and be able to pull up references and websites just to show them, like, this is what the experts say. So that's one of the reasons why, study, and they kind of expect a lot more from you.
That's a good advice. You have to know what you're talking about, and like people just go on Google and look at the reviews and then they choose dentist. So you have to know what you're talking about and be professional. How would you navigate the talk about your weakness question at interviews?
Be honest about it. Honestly, like 2 schools asked me that during my interview, and the only thing I could do was be honest about it. I could tell you can be as candid about things as you want to. You can literally say, I've heard not excuse, but weaknesses explained in a way that, I went through this, but this is what I did to get past that weakness. So one of the main things is be frank about your weakness. Say, you know what, I'm human, this happened, but how did you learn from it? How did you better yourself from it? Like personally, I didn't have a very great GPA for my dental school in India. So the way I explained that was, I didn't have a good GPA. There were things which happened which were out of my control, but I made sure I became better. I started getting more involved in like CE courses. I went out of my way to show that I was willing to learn. And then that's one of the reasons I did my master's, because I wanted to show myself that I could handle a big course load. So trying to tell them what helped or what good came out of that weakness is going to help you in the long term. And that also comes back to the same gap year question, because sometimes they kind of frame it that way. Try to tell them what came out of the gap year. Always start off with the honest fact and then tell them what good you learned from it.
Well, let's say if a student is failing pretty bad at school, for example, GPA is pretty low, and the student takes a master and then still got that grade, how would you is there another way to back up? If you got 2 bad GPAs.
You got 2 bad GPAs and stuff happens, maybe for some reason you also working 3 jobs at that time to support someone, or maybe at that time, you just didn't know better, right? But then show what you can do after that. Because failing in your dental school and then failing again in your master's, that is definitely going to show, well, as a weakness in this case. But then what you can do after would be maybe taking courses at a community college, saying that, well, my weakness was in academia and in academics. So what I went ahead and did was I took classes in these other things to kind of show that I can still be better. I can still study harder. And that's also going to reflect well on your whole application process, because you didn't let that one failure or even the 2 failures define you. You went out there and showed that you can overcome those failures, and that's what they're wanting to see. It's not how many times you fail, but how well you get up.
That's true. And I think this question will be a really good question for you. Any tips for managing a heavy schedule?
Oh, yeah. I have a planner. So I literally have this one book where I write down everything so I don't forget things. But then besides that, people have their own ways, right? So you can have your online calendar, like your Outlook calendar, but making sure you're staying on top of things. Make lists, make mind maps, do whatever it takes for you to get organized, because one thing won't work for everyone. Not everyone's gonna be able to use a planner the same way. So try different tools, see what works, see what doesn't work. And also remember that in dental school, everyone's together. So you do have classmates who end up helping each other. So if someone can't find a link to a Zoom class, they just post it in a class group chat and like, hey, what's the link? And there'll be like 5 people sharing the link. So remember that you're not alone in this. It can be daunting, but that's another reason why you need to find your support system, and help each other stay organized. There are times when my friends and I would share, hey, this assignment is due tonight, did you finish it? And then someone would be like, oh my god, I should. So having that support system helps, managing a heavy schedule. But also another thing is taking time for yourself in that schedule. And what I mean is intentionally scheduling time for self-care. Either one of my friends, she blocks off 2 hours in the evening for working out. So even if everyone's going out together, like for dinner, she'd be like, no, I have my workout, I have to do it. So find what gives you joy and do that, and block it out in your schedule and then do that. So that way you're also having that work-life balance. Does
I
that
remember,
answer it?
yeah. I remember you said for the weekend you don't do any dental stuff work, right?
I try not to. Yeah, I don't.
Okay.
So I'm like spending time with my husband, my pets, and then cleaning, cooking, baking a new dish. So, or making like silly Instagram reels of my dog. So just trying to do something else which is not dental will help you from burning out.
So you fit
Yeah.
those homework and other clinical stuff during the weekdays,
During the week.
during the
And
week.
that's one of the reasons why you don't put things off to the last minute. So if something's due on a Sunday, you're not spending your whole Sunday morning doing
Yeah.
it. Maybe breaking it up over the week, like from Monday to Friday, getting a little bit done. And so your weekends you can actually have for yourself. Granted, there will be faculty who post a quiz on a Friday evening and expect it done by a Sunday night. But you know what? That's okay. That's still just one thing versus keeping everything for the weekend. And that way you're not having any time for yourself. So just break up your tasks into smaller tasks and celebrate every small victory.
Hmm. Can you talk a little bit about what was easy and difficult about working in the US as an international trained dentist?
So, what was easy was a lot of the theory knowledge and the background knowledge that I had, because a lot of like the didactic things were easier to understand, were easier to pick up. And having had some experience in India, I was able to bridge a lot of the gaps too. So, that made this transition a lot easier. But the hardest things was trying to break old habits. Like, for instance, I remember my very first sim lab. I'm sitting with a typodont. We didn't use a rubber dam in India. And even the ones we use were pretty much not of the same caliber, right? So most of the time we just didn't use it. So here, forcing yourself to work with a rubber dam was like, oh my God, it's just getting in my way. But then trying to break those habits were really hard. Patient positioning was hard. So small things like that. So the only way you can get past that is practice, practice, practice. And with time, it just becomes second nature. And now you don't even think about it. You just get the rubber dam on, and you get going. So it's all comes down to practice. But I'm not saying it's easy. I'm not saying you're going to get it overnight. There definitely is a learning curve. But if I can do it, everyone can. So yeah.
It's also common to use rubber dam in the United States compared to other countries, if I'm not
Yeah,
wrong.
it's a standard of care. If you are doing a root canal without a rubber dam, then you can even face a liability, like a lawsuit for it,
Yeah.
because it's a standard of care here. And so if you are not using a rubber dam, then you're doing something unethical. So
Mm-hmm.
yeah, or use an
Is,
isovac, but at least something to protect the patient's airway.
yeah. Is the program at Colorado integrated with the national students?
Yeah, it is. So we take a lot of classes with our D3s and D4s, and it's nice because they have experiences which we don't, and we have experience which they don't. So it's nice that way we get to like work off of each other. And it's also it's a nicer feeling when you go to your clinic and you know other people, right? So beyond just the 40 of us in our class, which is a big program for an international program, but it's nice to know other people from other classes. So we take like our pathology courses together, oncology, critical thinking, critical appraisal. So a lot of courses are taken together, and we are in fact put into groups where we can share with each other, and that's kind of nice too.
How is the clinical experience in Colorado?
It's really good. Granted, Colorado, like most schools in the US, are going through transitions now because of COVID. Like most schools, we had the Great Resignation, which where a lot of faculty retired. So there was a lot of faculty being shuffled around the whole of the US. So that's not a thing on Colorado. It's throughout the US. So, but then in spite of that, our clinics were one of the first to open back up to full capacity, and we haven't had an outbreak. So, and we're still with a full patient pool. So that way, it's been very rewarding to be here at Colorado because they really look out for us. So we have our own coordinators who we can go to and talk if we talk about our patient problems, saying that okay, so I need to do all of these requirements, but I don't have the right patients for it. So you can always go and approach your coordinators and they will make things happen. They'll move mountains for you. So that way it's been very helpful, especially with COVID and everything going on, to be here at Colorado.
And also the professors in Colorado, there a lot of them are also from international, like other dental school.
Yeah, a
So
lot
it's
of our
very diverse.
faculty, yeah, a lot of our faculty have gone through international programs too. And that's nice because they're then able to understand some of the unique situations that we have gone through. In
Yeah.
fact, the director of our international student program, Dr. Bhaskaran, she herself graduated in India and then did an international program and is now the director of our program. So that's how well integrated they are to how international students work.
Are you planning to be a professor there in the future?
I don't know. Probably academia isn't for me. I like more hands-on dentistry, and I've done my teaching, so I've done my share of teaching. And while I like the students, there's also a lot of like paperwork and things which I'm just not cut out for.
Hmm.
So maybe things would change. I don't know, but probably not.
Okay. Do you suggest writing a template for a professor when writing a letter of recommendation?
I would kind of stay away from a template because that becomes like an ethical gray area, saying like
Yeah.
this is kind of what you want to follow. But then what you can do instead is give them a copy of your resume. And then in the email where you're sending them your resume, you can mention all the activities you've done and remind them of things that you've worked with them on. So when I was getting my letters of recommendation for Colorado, I did ask my lab coordinator from my master's program for a letter of recommendation. So what I did was I told her I used to work, so many hours a week on this project, which you headed. Then I volunteered in these projects, which you oversaw. Then you gave me these opportunities, which I followed through on. And here's my resume. Please, could you write me a letter? Right. So that way she also because they are seeing like hundreds of students every day. So she also knows, gets a refresher on the things that I did. And she can write a letter which is more me than a generic letter. So yeah, but definitely give them a resume and then remind them of everything you've done, but don't give them a template. And another important thing when letters are concerned is give people at least a month's heads up. So if you know your capit applications are opening in say April, let them know in late February, saying, my letters are going to be due in April. Don't wait for the last minute, because people are busy, and the more you push it off and then ask for letters in the last minute, the more generic your letters are going to be, and the more generic they are, the less value they are to your whole application. Because what people are looking for is if the candidate themselves. So if my faculty member is going to say, Alisha helped me on this project with this and she did this, that's going to speak better than she was an excellent student. Excellent how? Excellent leadership skills, excellent teaching, excellent learning, what? So give them lots of time to come up with a decent letter of recommendation.
That's true. You also have to like guide them about the process and everything. That's
Yeah.
true. That's true. And the last two questions. As a
Mhm.
fresh graduate, what can I do to compete with other applicants with years of experience?
Just be yourself. I mean, we have people in our program who were fresh graduates, who didn't have any work experience, and they literally graduated from their home countries and have started our program. So there are things which you could have done while you were in the program and highlight those. Did you were you a part of a study club or a journal club while you were in school? Did you have any leadership experiences? Did you have any like group experiences where you headed? What kind of volunteering did you do in school? So all of that is going to also add to your resume. So just because you're a fresh graduate, don't stop that from applying. You definitely are in the running because of that. In the meantime, if you think, okay, while the application process is going on, what do I do? Try to work on whatever you like working. Is it shadowing a specialist, or is it working as a general dentist? Find what you want to do and do that. That itself will help you. And
Got it.
also start preparing for your INBD, because that takes a
Hmm.
while.
Okay. Actually, we have last two more questions. Sorry. The last
Okay.
what's your favorite tooth and why?
My favorite tooth.
Yeah.
Okay, so I can't pick a favorite because they're probably 8 and 9. So they're like
Hmm.
the central upper incisors, because that's the first thing you look at, right? Like as soon
Yeah.
as you see someone, that's the first thing you notice. If that has a tiniest of chips, people can pick it up like psychologically, even if they're not a dentist, right?
Hmm.
So it just shows that you are a part of a whole ecosystem, but then you're the first one who you still stand out. That kind of like, and in fact your faults stand out more than your perfections. So use that, take that however you
Hmm.
will.
Hmm. Okay, the real last question. What's a class demographic like in your IDP program?
So we have a mix. So when we say demographic, we have people from all over the world. Um, One of the things is people in Colorado doesn't differentiate based on country. So if your profile is strong, they'll accept you if you're a good candidate. Some schools might differentiate based off your country of origin, but so we do have quite a few Indian students, people from all over Pakistan, Egypt, Iraq, Russia, all over, you name it. Um, we've had people who are fresh graduates, people with decades of experience, people with research experience, people with none, people with clinical experience, people with none. So they intentionally do that, so they intentionally choose people from varied backgrounds so that they can benefit from each other's strengths and weaknesses. So that's one of the other reasons why, no one size fits all, because schools want a variety.
That's true. So be diverse.
Yeah, be diverse. Go
Yeah.
learn a bunch of languages, go travel the world, and be diverse, and help others out when you can.
Hmm. Hmm. Okay, I think that's all we have for today. Thank you so much,
Okay.
Dr. Alicia, for the time.
Thank you, Scott.
And the quiz will be in our link tree. So be sure to go do the quiz, and you will get your extracurricular hours. Thank you so much.
Thank you. Have a good day.